My name's Priscilla Robinson. I've been associated with the World Federation of Public Health Associations, for about 10 years now, having been a member of the Public Health Association of Australia for nearly 35. An adjunct professor at a university in Australia called La Trobe University. Currently co-chair this working group, and I have a number of other hats that I wear by professional training. Originally, I was a nurse and various versions of nurses, and then I ended up training as an epidemiologist and in infectious diseases in public health. That's very briefly my career, and a teacher.
So my name is Leanne Coombe. I am employed as the Policy and Advocacy Manager at the Public Health Association of Australia. I also co-chair this working group, the Professional Education Training Working Group. I've been involved in the World Federation and this working group since 2018. I'm also an honorary associate professor at the University of Queensland in Australia. And my background originally was in oral health before branching into public health more broadly and specifically working in Indigenous health.
So in terms of why I decided to pursue a public health career, all my original training was in preventive health. I happened to do a course that was very much focused on preventive health, and despite the fact that I trained as a nurse, I never wanted to do nursing in a hospital. I always wanted to do work that was associated with prevention. So working in public health was the natural home for me, and always has been for my entire career.
And for me, working in Indigenous communities, I saw the effects of the social determinants of health and was needing to address them. And so went on and did my public health training, and so got out of the clinical space and moved into policy and advocacy work, but also managing services that address those social determinants of health for the communities in which I was working.
The Federation has a review of its working plans, often, as all good organisations do. And 14 years ago, the Federation identified the need for a professional education and training working group, which I was the second and continuing. Originally, I was the chair, and then I became co-chair because I just decided that Leanne would be a really good person to come and help me do this work. And she's been fantastic. And so the working group took on the work identified as necessary at the time by the Federation, and has continued to develop its work since then, and contributed quite a lot, I think, to how the Federation's overall work has happened.
When I joined Priscilla as the co-chair back in 2018, I think it was, we were a fairly small group. It was initially quite a small and relatively inactive group, which is why Priscilla kind of tapped me on the shoulder and asked me for some help. But since then, the work that we've been doing has created a whole lot of interest, and we've had academics from around the globe getting in contact with us, expressing their interest in the work and eventually joining. We've also been consciously building the membership of the group, and we started out with a small internship program, which we've been building over the last few years. And a lot of the interns that we've had come on have expressed interest in also staying on. So we've got a membership that ranges from really early career public health professionals who are interested in education and or are still involved in and going through their own education and contributing from that end of the scale right through to the experienced practitioners and academics that are teaching in that space, that are contributing their knowledge and expertise to the conversations that we're having around standardising public health education.
So it's important to note that although it is a very diverse group, and it's globally diverse and ethnically as diverse as we can make it. In many ways, it's a reasonably informal group, and the members feel very comfortable talking to each other, regardless of what level of education they're at. which enhances our work and is possibly a kind of a message for people developing working groups, because the people who are very experienced and very busy don't have a lot of time to contribute to work like this. So we've very deliberately, but very luckily, found a collection of people who have the wherewithal and the energy and the time to really contribute to this work. So, so we can use our members in various ways, which has been really helpful. We've we've done and published a number of pieces of work to do with public health education, starting with an analysis of public health competencies, which is being used quite widely in the public health education domain. Because of our co-chair of this working group, we've also been invited and to join the work of the World Health Organization roadmap project. The roadmap is for securing the public health and emergencies workforce roadmap project, which is just recently published first phase report. We've both there are three sections to the roadmap project, and one section is specifically about public health competencies. And I have co-chaired that working group, and Leanne co-chairs a sub-working group of that group in order to roll out how the public health competencies can be incorporated and secured in public health education worldwide. In that sense, the Federation has had big influence in how public health education should be rolled out worldwide for the next many years. And those documents, in particular the competencies document, is easily available on the World Health Organization website.
We've got a number of projects that are currently underway. At the end of the design phase of the roadmap, we're now moving into the implementation phase. So we're using the competency framework that was developed as part of that roadmap project to start talking to accrediting and regulation agencies at the global level about how we can now come together to implement that competency framework, but also then look at how we standardize education for the public health workforce around the globe, just irrespective of the subdiscipline that it might be applied to. The other big project that we've currently got underway at the moment is benchmarking public health education around the globe. So we've got a big research project underway, and we've got a number of interns that are also contributing to that work, where we're going into the websites, but also surveying the various institutions that provide public health education to look at exactly what course content is being provided, how it's being provided, what kind of training the faculty that deliver those programs receive, and what support they have, the modes of delivery, and so on, and looking at then what the patterns are that come out of that data to inform the standardization work that we're then talking to the accrediting and regulating agencies about in terms of implementing the roadmap. So they're the two big pieces of work that we're currently undertaking.
Well, where can public health go? So I suppose we have to consider that post-pandemic, the public health landscape did originally change, but we need to make sure it stays changed, and that don't all return to life as was considered normal in public health terms before the pandemic, because the working group is very aware of the fact that globally, only about 1/5 of the public health workforce is trained in public health. And equally, many people who are trained in public health have difficulty in public health. So we need to find a better, that's partly why the work that Leanne was just talking about accreditation and regulation of the workforce, we consider to be very important, because it is possible, very possible, for people working in public health who don't know what they're doing to make quite bad mistakes and endanger the health of the public. So we're very keen to continue that work. Thinking a bit more globally, there's a whole area of public health which needs to be considered in different ways. For example, many people have jobs where a little bit of public health is involved. So they might not do it as part of their main job, but they do little bits of it. So just about anybody that has any kind of professional training at all needs to understand what public health is, needs to understand how their job contributes. So a little bit of public health training in almost every degree would be something that we would envision for the future. Although that's a very long-term project and would be very, very difficult to get underway. So there are plans that we have which are nowhere near consolidation yet, but which kind of bubble away in the background of our thinking, and we will work on as our work evolves. What else are we doing, Leanne? We're doing so many things.
I guess the other piece of work or pieces of work that is starting to emerge now that the work of the roadmap is starting to quieten down with the end of the design phase, is looking at how we then support other working groups across the World Federation in implementing the roadmap within their specific discipline areas. So already we've been approached by the Indigenous Working Group to assist them in terms of thinking through what decolonising public health might look like in terms of educating the future public health workforce. We've also been approached by our One Health colleagues and those in the area of climate change in terms of how they might then embed the relevant competencies from the roadmap into the frameworks that are then used to educate the sub-disciplines. So whilst there's been this big piece of work that we've been involved with and consumed by in the last few years, it'll now be drilling down into the detail of what that looks like and how we can support the other groups within the World Federation to roll those pieces of work out more broadly.
Plus, the WHO roadmap project has finished that phase, but we also will continue to support the project as it matures and goes on to its next phase. So we're not short of things to do. So anybody that wants to come and help us is welcome.